The following is an exclusive presentation of Optimum. We're your TV, phone, and internet company.
This year, the flu season started early and is epidemic throughout the United States.
But what can you do to help prevent the flu and stop the spread?
We have answers on this week's Health Talk.
We're up next.
Hello, I'm Dr. Andrea Peterson.
And I'm Dr. Eric Mazer. Today we're going to discuss influenza, the disease influenza. Our guests are Dr. Paolo Pino and Dr. Julie Varughese. I'm going to get this right. They're both infectious disease specialists with the Norwalk Medical Group.
Welcome, Julie, and welcome back, Paul. We're so glad to have you both.
Great to be back.
This is actually a very timely show because, as we mentioned, we are actually in the midst of a flu epidemic, aren't we, Paul?
Yes, we are. We started very regionally, but it's pretty much across the United States. And if you looked at the map a week or two ago, you would have seen that it's pretty much blossomed all over the United States. And regionally, it's been a lot of news, and Boston specifically in our areas is counted a state of emergency because of the amount of deaths and illnesses. And we've seen our share here locally and in the state of Connecticut.
And Julie, the flu is not just any disease, is it? It's a very specific disease, and I think people misuse that word all the time. So why don't you tell our viewers what the influenza is?
Definitely. The specific disease influenza is a viral illness that can often be kind of confused sometimes with nonspecific flu-like symptoms, the stomach flu, the common cold. But influenza is a specific illness caused by different influenza viruses. And often the symptoms, although they can be nonspecific, there are some symptoms that are particular to influenza, such as very high fevers, body aches, extreme fatigue. Sometimes you can have certain GI-related symptoms such as nausea, vomiting, diarrhea, sometimes a dry cough and sore throat as well.
And Paul, we really want to be very specific about influenza because, as you mentioned, it really can be a very serious illness.
It is. It can be. The symptoms typically are hit the very young and very old very hard, or people with a lot of medical problems, dialysis patients with altered immune systems, patients on medications that alter their immune system. So these patients are typically at the highest risk, but even someone who has a normal immune system, it's not a traditional type of cold where maybe you can function through this. Most patients tend to stay home from work. They don't want to move. The body aches and the fever are quite disabling.
The headache is part of that too.
Headache is, and the body aches, the fatigue. It's quite uncomfortable.
How about runny nose? I think some people think that a bad cold is the flu, but it's not really the case.
No, I mean it may be part of it, but I want to stress that it's usually the typical symptoms are that people usually it's very unique, and it hits you all of a sudden, and you're really unable to sort of function with daily things.
Fever is an important part of it, isn't it?
Typically very high fever. Yeah.
So a high fever can be one of the clues that this is not just an ordinary cold. And Julie, why do we worry so much about the flu? Because it does kill people. And what happens that ultimately kills people?
Well, as Paul mentioned, the flu can hit certain groups very hard. As you mentioned, the elderly, younger children, patients with other illnesses, and so it can cause other complications. They might just initially get the flu, but then can have other kind of complications that arise from getting the flu. It can be very debilitating. And so it's very important that, especially patients in these types of categories, that they do seek medical evaluation.
One of the things we worry about the most, right, is influenza pneumonia and kind of real pulmonary infections and lung compromise from that. Maybe you can tell us a little bit more about that.
Well, at times patients who do get the flu can develop bacterial pneumonia on top of what's already going on as far as a viral process with influenza, and that can be very severe and can sometimes lead to death.
I remember during my internship back, I won't even say when it was back, but we had a particularly severe influenza year, and there was a young man in his early 30s who was an insulin-dependent diabetic, and he died of influenza pneumonia. And it stuck in my mind my whole career that this, was what looked like a healthy young man, but he had that underlying disorder, and he died.
The complications can be very serious. We've seen patients who, because of the body aches, the muscle breakdown, have led these patients to be on dialysis. It affects the heart, can cause some heart issues. It can affect many other organs, and these are all complications related to.
Yeah, and the muscle aches may be another real clue that you're dealing with. The high fever and the muscle aches are another clue that you're dealing with, not just the cold.
Right.
Paul, maybe you can start telling our viewers a little bit, when should somebody who has a fever, is achy, when should they really go see their doctor? When should they really be thinking, maybe this is really influenza?
Well, the first thing is to make sure we get a flu shot, but that's prevention, and maybe we'll talk about that later.
Absolutely.
But as far as the symptoms, if you haven't received a flu shot, or if you have, the earlier you're able to be evaluated, at least contact your doctor, the better you are. And your doctor may, depending on how your immune status is or how healthy he thinks you are, may just recommend some supportive care. But there are some steps, some medications at the earlier start that you may shorten that time frame that you are ill. So
you're not saying that everybody with influenza needs to be specifically treated with an antiviral agent, are you?
No, some cases are fairly mild, and the medicine, if you're young and healthy, it's not necessarily necessary, but trying to get through it symptomatically. But if you have an immune system problem, and you have these symptoms, if you are elderly, if you have COPD, which is a lung emphysema, lung issue, or a dialysis, then you're at much higher risk of developing the complications we just discussed. And that's very important to discuss.
So I think this is really an important part of the discussion. So Julie, should everyone with the flu call their doctor or their healthcare provider, or should it be only people who suspect they may have an underlying disease?
I think it would be beneficial for even young, healthy people who suspect that they do have influenza to at least contact their primary care provider, just to have a conversation about what their symptoms are, supportive care measures that they could potentially be doing at home. If there's any worsening, they should be seen in the office. So I don't think it's necessarily just the higher risk populations that should contact their primary care doctor.
But we also have the issue of spread, and maybe you can talk a little bit about how it's spread, and then we can talk about how we all can help prevent spreading.
Sure.
It's spread through droplets, and so usually within 3 or 4 feet of somebody. But there are certain precautions you can take.
So droplets, if somebody coughs or sneezes into the air.
Right. So we always are taught to kind of cough in your elbow, and hand washing is obviously very important.
And I've also heard that, since you pick up these droplets on your hands, and this is really hard, but try not to touch your eyes, your nose, your mouth. And I heard some incredible figure that we touch our face 1,000 times an hour, or some enormous number.
It's a very unconscious habit that we have, but yes, it's very important to try and avoid that type of.
Which is why hand washing becomes so important.
And do the alcohol stuff, the Purell and those that you can carry around in your pocketbook or your pocket, do they work to kill the flu virus?
They do.
Yeah,
yes.
they do.
Alcohol-based solutions like Purell or Germex can. If you have clean hands, you can use those. Hand hygiene, just hand washing also.
So that we can really, again, help spread it, help keep from spreading, keep from getting it ourselves by constantly washing our hands with these alcohol-based washes.
Julie, what should folks at home do if one of the family members has been diagnosed with influenza?
As Paul mentioned, it's good just to practice basic, preventative measures such as hand washing, covering their mouth when they're coughing into their elbow. They really want to try and minimize direct contact to avoid that droplet spread, per se, from an infected family member.
Should they go be sequestered in a bedroom?
I don't know if I'd go that far. I mean, maybe there are some patients, depending on what their doctor would say, if they're very high risk. But hand hygiene, again, the measures that we had discussed, I think, would be very important. But it is important to always discuss, I think, these issues with their own physician and have them involved in the discussion, whether or not more needs to be done as far as that.
And what about the other way around? So say you've been diagnosed with influenza, or you have symptoms that may be consistent with influenza. What can you do to help prevent giving it to other people?
So again, the hand hygiene issue, covering your mouth. Some people choose to wear a regular surgical mask. Those are steps we usually take in the hospital for these patients, or in nursing facilities. And if one is concerned about their partner or children, again, to contact their physician. If one has not received the flu shot and is very high risk, there are some preventative Tamiflu medications that can be given to them if they're at a high risk of developing the flu because they live with someone who has been diagnosed
and it
as
may be, Julie, not the right time to go see grandma or grandpa, right? If a family member has been diagnosed with the flu, and people should think about staying home from work to prevent spreading in the workplace.
I was just going to bring that point up, that I think that one thing people can do is if you have symptoms of the flu, and you can even broadly define that as respiratory symptoms and a fever, stay home. This is not a time to be tough and prove to your boss that you can work through this illness, because you're endangering the whole office, the whole workplace when you do that.
Right. And especially the elderly whose immune systems may not be normal, small babies whose immune systems may not be fully developed, and other people who may have illnesses. You should really try to stay away from and not get them sick.
Yeah, you want to try and minimize contact, I think, as much as possible while you're kind of in the height of the symptoms.
What are you doing in your office? Because I've also heard people's offices and emergency rooms discouraging otherwise healthy people from coming in with the flu.
Well, patients who decide to come in and we do welcome them. We'd like to evaluate them, but certain patients we do offer surgical masks in the office, and so there may be some signs that say if you have active flu-like symptoms, there may be a list of them. I know when you enter Norwalk Hospital, there is a list there, and may not want to go if you're visiting someone with those types of symptoms, and doing that, and maybe segueing them into a room a little quicker. And we also have these hand hygiene Purells on the walls and things like that to have patients keep their hands clean.
So this is the time where, if you're not ill, there are things to do to protect yourself. But I think if you're ill, you have a real responsibility to the rest of your friends and our citizens to stay away, and protect them from the flu. We're going to talk more about the treatment of the flu and some of the specific things that we can do when we come back, but we'll be back after this short break.
Don't go away.